taking on the big shot and working hard to get you answers. Steve Andrews is Target 8.
Well, the complaints are wide-ranging, from VA staff taking patients' parking spots to ER doctors and nurses asleep on the job. Veterans and their families vented frustrations with the way that they are treated to VA administrators.
They got their chance to do that at a town hall meeting held at the Bill Young VA Memorial, actually the VA Medical Center, also known as Bay Pines. Now, a good deal of what they heard is exactly what our Target 8 senior investigator Steve Andrews has been talking about and exposing over the past year.
Yeah, this was a forum where veterans and their families could just let it out.
Right.
And they did. They let administrators know about their dissatisfaction with red tape and inattentive health care.
I can tell you, what I have seen here has scared the crap out of me.
There were plenty of complaints.
And I was very dissatisfied with your emergency department.
My knees are shot. And when I go up and down steps, it sounds like popcorn popping in a microwave.
And plenty of these.
I apologize for that type of experience. I'm sorry that we're not living up to your expectations.
More than a year ago, Target 8 told you about problems with the Veterans Choice Program. Veterans like Luis Salvato experienced long delays getting appointments in a program set up to speed things up. Well,
they're absolutely useless.
So I feel like the motto that I live with the VA is delay, deny, and hope you die.
Target 8 also reported veterans like Rod McKelvin and Tom Jenkins, whose VA disability claims were denied, could expect their appeals to take longer than America's involvement in World War II, 5 years or more. Regional Director Julianne Bohr confirmed what we reported.
To be quite frank with you, our appeals process is broken.
And if things don't change,
you can count on that number doubling and perhaps tripling, waiting 10 years if we don't do something.
Veterans provided plenty of problems for administrators to address, like delays in emergency.
There were several staff either shooting the breeze or on their cell phones. I consider that very substandard and unprofessional.
Any contact that I had, I went through the physicians, one of whom had her head down and she was asleep.
And runarounds on the phones.
The answer I got to the same person I started with was, I lie a lot. I'm only an office clerk. It's a process.
Every time I reach for the phone to call VA on something, I think my blood pressure goes up about 30 or 40 points.
One veteran said she spent 7 hours on the phone with the VA trying to get her prescription refilled and still couldn't get it done. I mean, you could just feel the frustration in that room yesterday.
It was a laundry list of complaints, too. You have patients parking. The employees are taking the patients parking. You've got delays in the ER. I mean, this is when you have an emergency. You don't want to delay there. A doctor asleep on the job. I mean, what are the administrators going to do about these complaints?
Well, they said they will address it with staff. But, you know, perhaps most concerning is the warning that the length of time to process an appeal could double or triple, a process that has not changed in 80 years. Now, we have a new administration, we have a new VA secretary. It's time for some new thinking and some sweeping changes. We can't sweep this under the rug anymore.
And right now you got this hiring freeze going on, and that kind of adds insult to injury.
It does, but part of that is exempt. The VA is exempt if people, positions are for public health or service, providing care to the veterans, they can still fill those positions. Yeah.
Well, thank you, Steve.
Yeah. Thanks. Well, if you have a problem you would like Steve to investigate, call our Target 8 helpline. The number is on your screen. It's 1-800-338-0808.